Central Venous Access Devices, CVADs. The CVAD may be accessed in the event that you have a patient in an arrest or near arrest state who requires either IV fluids or medications, and you are unable to acquire peripheral IV access. The first CVAD access demonstrated here is the Hickman indwelling catheter. For this skill, you will require two 10 cc syringes, one filled with normal saline and one empty, alcohol swabs, a primed IV tubing attached to a fluid supply, and a Sharps biohazard container. Be diligent to use aseptic technique when accessing a CVAD. Prepare all your equipment in advance. If your service does not carry preloaded normal saline-filled syringes, you will need to prepare one using a 10 cc nebule or vial of normal saline, an alcohol swab, and an empty 10 cc syringe with a blunt access needle. Uncap and cleanse the port of the normal saline vial. Withdraw 10 cc's of normal saline and express any air left in the syringe. This will ensure that air is not infused into the CVAD line, which can lead to an air embolism. Maintain the blunt access needle in place and set the syringe and access needle aside until needed. Locate and expose the CVAD. This indwelling device provides IV access for long-term therapies. It is a closed system that is comprised of an indwelling catheter tube, an inline clamp, and a Luer lock access port with protective cap. To initiate access, close the clamp and remove the protective cap. Attach the empty, sterile 10 cc syringe to the access port and engage the Luer lock. Release the clamp and withdraw 3 to 5 cc's of fluid from the line. This fluid includes heparin that is used to help maintain the patency of the line and blood from the catheter. Close the clamp and detach and discard the syringe. Next, attach the saline-filled syringe after removing and discarding the blunt access needle. Secure the syringe to the Luer lock and again release the clamp, allowing the saline flush to now be infused to assess patency. First inject 2 cc's of saline and then withdraw 2 cc's of blood. Complete the process by injecting up to 8 cc's of saline. This process confirms that the line is patent and accessible for fluid and drug administration. Close the inline clamp, disengage the syringe, and dispose it safely in a biohazard container. Note that through this entire procedure, the CVAD port is always in control of your non-dominant hand, so you can maintain visual contact with the port and minimize risk of contamination. Next, attach the IV tubing, engage the Luer lock, and open the inline clamp. Then open the IV tubing roller clamp and set the IV flow to the desired drip rate. Secure the line in place with tape. In this example, we are going to access an implantable venous access port, an example of which is Portacath. This device is implanted subcutaneously and is accessed externally using a specially designed needle called a Huber needle. Unique features of this device include the 90-degree angle of the needle so it sits flush with the skin after insertion, the attached tubing, the inline clamp on the tubing, and the needle opening, which is on the side of the tip rather than on the beveled end of a standard needle. This needle is required to access the implanted self-sealing disc that is attached to a tunneled central line hidden completely under the skin. Prepare your equipment in advance as you would for a Hickman-type CVAD demonstrated earlier. This includes 2 10cc syringes, one filled with normal saline, the Huber needle, and alcohol swabs. Palpate for the IVA port, which are generally located under the skin over the upper chest wall. Cleanse the area with an alcohol swab. Attach the Huber needle to the empty 10cc syringe and ensure that the clamp is closed. Insert the needle straight into the implanted disc and stop when you meet resistance as the needle tip makes contact with the back wall. The needle pierces a thin rubber membrane in the IVA port, which self-seals when the needle is removed. Open the clamp and withdraw 5 to 8 cc's of blood, then re-clamp and close the catheter. Remove the syringe and discard safely. Then attach the saline-filled syringe. Open the clamp and infuse a couple of cc's of saline. Withdraw to ensure the line is patent, and then continue to infuse the saline, leaving 2 cc's in the syringe and closing the clamp before releasing the plunger. Remove the syringe and discard safely in a biohazard container. Next, attach the IV tubing, engage the luer lock, and open the inline clamp. Then open the IV tubing and roller clamp and set the IV flow to the desired drip rate. Secure the line and Huber needle in place with tape.